Well, this is Women's Health Week, and each night we focus on a different health issue affecting women. We continue tonight with the topic of fibroids, very familiar to a lot of us. 20 to 80% of women develop fibroids by the time they reach 50 years old. Women who develop symptoms often find fibroids hard to live with, cause pain, and heavy menstrual bleeding. Well, here with us to discuss this important topic is Dr. Cheruba Prabakar. She is a OBGYN at Maimonides Medical Center and attending physician and fellow in minimally invasive gynecologic surgery. I dare you to say all those words. And Gessie Thompson is the author of Hope Beyond Fibroids. She is a former patient who suffered with infertility and is now a fertility coach. Welcome, ladies, to Arise America.
Thank you
so much for coming. We've got a lot to talk about in, unfortunately, a short period of time. But Gessie, I want to start with you with your story. And as I read about it, it's just incredible what you've been. How bad were fibroids for you?
It was huge. All along the 10-year journey, it really was the hurdle I kept having to fight. You know, I had 3 myomectomies, and each one ended up with complications where I had to have another surgery. So you're talking about a 10-year battle, 5 major surgeries, and then I had a miscarriage because the infertility ensued, so I had to do IVF. It wasn't just something that affected me where I just had to have the myomectomy. Now I had restricted options for having a child, so I had 5 IVF cycles. And then my heart stopped on the table in the surgery. But I have a miracle baby.
Yeah, and you're really jumping over the story. A lot of people know. I want to stop and just point out to some viewers who don't know medical terminology.
Absolutely.
Myomectomy is a surgical removal of the fibroid without removing the entire uterus.
Correct.
And I just want to take a moment and pull out something in your story. You know, through all of these courses of IVF and your myomectomies, these surgeries to treat the fibroids, they would come back, and they come back
every
worse.
Every 4 and 5 year cycle. That's why I said it was like this hurdle I kept having to fight.
Did it take over your life and how you felt as a woman?
It became worse every time. It was at the point where, you know, I work with a nonprofit called the White Dress Project because we talk about wearing white, which I'm wearing today, because the last go round, I was hemorrhaging so much. You can imagine what that means. You know,
yes.
You didn't feel like you could wear white.
Yeah,
right?
absolutely.
Exactly.
And so I want to bring you in, doctor.
Yes.
So first of all, so many people, so many women, particularly women of color, have fibroids. Let's just talk about what are they and why are they so overrepresented in African American women?
So fibroids are benign. They're muscle tumors that grow in the wall of the uterus. They can be inside the uterus as well as right outside the uterus. You're right in that it is overrepresented in women of color and especially African Americans. But unfortunately today, even with all the research that's going on, we don't know, we can't pinpoint one reason as to why this is. There are some genetic factors, some environmental, but there's a lot of research still going on.
I mean, honestly, I don't think I've ever met a black woman that didn't have fibroids.
Right.
It seems like we all have them, but
Absolutely.
when do they become a problem? When do they pose a health risk?
Right, so they actually start right in the early 20s and go on to the 30s and 40s, but in black women, oftentimes we see it in the childbearing age, which is the mid-20s. They present with pain, bleeding, and depending on the location of the fibroids can certainly be a problem in terms of fertility.
And I remember when I was growing up, and even in my earlier adulthood, talking to women who were dealing with those extreme fibroids that you've dealt with, and there were 2 options. You either dealt with it, or you got a hysterectomy. There's a lot more out there, a lot of other options out there now.
Absolutely, and very fortunately so. So you can do medical management in terms of, you know, birth control pills or Lupron. And as you mentioned, the other extreme was hysterectomy for those who really had extremely big fibroids. But thankfully today we have options like uterine artery embolization and most importantly minimally invasive surgery for just the fibroid removal, which is a myomectomy. We use the laparoscope, we use the robotic platform today, and that's what I do, and it's absolutely wonderful. Women can go home the same day and return to work and get back their lives.
Truly, the good news is that there is hope, and I know that that's your message now, Gessie. Before we talk a little bit about your new mission in life because of your experience, you have a beautiful little girl who is the living, breathing example that there is hope. I think we have a picture of her. Let's put Nia up. So you finally got pregnant after how many rounds of IVF?
5 IVF.
After 5 IVF rounds, and then at 21 weeks, I understand that you found out that the fibroids were literally sucking the life out of your baby.
Literally, she was fighting for her life.
And so you went on bed rest, hospitalized bed rest.
No, she was my doctor, caring for me in the hospital, yes.
Yeah, for for 2 months,
Mm-hmm.
and then gave birth to Nia prematurely.
Healthy, strong, feisty, but tiny.
But why is this important? So this really has changed some of your mission in life and what you do. Why is it so important to minister hope to women who deal with fibroids?
You know, when you're going through something so traumatic, sometimes you don't realize the impact you can have on other people. And when Essence, was gracious to allow me the platform to share my story, and it's in the May issue of the magazine, they actually touched on something that it became a rippling effect. Women all over messaged me. It was like 33,000 likes on their Facebook page. They were messaging not just their comments of, this is good, but oh my God, you gave me hope that I don't have to give up. So now we formed this Circle of Hope prayer group for them. And we're writing this book, Hope Beyond Fibroids, because the key thing is we want to tell all their stories. When I hear women say, my God, you don't understand, I was ready to give up. I was that one IVF cycle away from giving up. And because I heard a story that encouraged me, I didn't give up, and I have the greatest miracle for it.
And that's what I want to ask you finally, Dr. Prabakar. Is Gessie the exception of the rule? She had extreme fibroids and was able to have a baby. Is it possible for those women out there who have similar circumstances?
Yes, and this is what I do every day. We operate on women with tons of fibroids, large fibroids, walking around for years, and there is definitely hope with all the options available today. Early detection, awareness, and treatment.
Hope, that's what we brought here today. Dr. Cheruba Prabakar and Gessie Thompson. Thank you both.
Thank
and
you.
Congratulations on that beautiful girl.
Thank you so much.
Take care. And you're watching Arise America.